strokes and mini strokes are pretty much the same pathology, except that mini strokes are known as transient ischemic attacks, where you have a minor stroke and your brain protects itself and you tend to recover from it. For example, you're sitting down quietly, you suddenly get a sensation of numbness in your face or your hands, you get weakness in your hands, your speech starts to get slurred, and over the course of the next 45 minutes to 1 hour or maybe up to 2 hours, you suddenly find yourself recovering from it. So that's a TIA, transient ischemic attack, where a small part of your blood vessel gets clogged up by a blood clot, and because of your brain's protective mechanism, your brain overcomes that blockage and resumes blood supply to the area, and you recover within the next 1 or 2 hours after actually getting those symptoms. So those conditions are known as transient ischemic attacks or mini strokes. We do see that quite often, and transient ischemic attacks or mini strokes are a precursor of a much larger stroke to come. So they should never be ignored, and treatment should be started immediately. Otherwise, you probably have a higher risk of developing a major stroke later. The symptoms of a TIA will be quite similar to symptoms of a stroke, where you can suddenly develop numbness of your face or your bodies or your limbs, you develop slurring of speech, weakness in your limbs, confusion, and they recover within an hour or 2 hours, as opposed to a conventional stroke, where you develop the symptoms and you're not recovering. Probably get worse over time. In TIA, these symptoms resolve in a matter of hours, whereas in acute stroke, the symptoms remain. And the only way to reverse the symptoms is to identify that you actually have a stroke and treat it immediately with whichever treatment options which are available and at that point of time the best for you.